Psychiatric problems among elderly. Elderly is someone who is old. Most developed world countries have accepted the chronological age of 65 years as a definition of elderly or older person. Although there are commonly used definitions of old age, there is no general agreement on the age at which a person becomes old. Individuals experience many changes as they age. Physical changes occur in virtually every body system, and psychologically there may be age-related memory decline and other problems. Many older adults are at risk of developing mental disorders, neurological disorders, or substance use problems, as well as other health conditions such as diabetes, hearing loss, and osteoarthritis. The normal emotional and physical stresses that go along with aging can be risk factors for mental illnesses like anxiety and depression. Beyond biological changes, aging is also associated with other life transitions such as retirement, relocation to more appropriate housing, and the death of loved ones. Risk factors: alcohol or substance abuse, Alzheimer's disease, loss of a loved one, long-term illness, physical disability, poor diet or malnutrition, change of environment, medication interactions, feeling lonely, loss of social status, loss of income, retirement. Older people are more likely to experience events such as bereavement or a drop in socioeconomic status with retirement. All of these stresses can result in isolation, loneliness, or psychological distress in older people, for which they may require long-term care. Mental health has an impact on physical health and vice versa. Older adults are also vulnerable to elder abuse, including physical, verbal, psychological, financial, and sexual abuse, neglect, and serious losses. Elder abuse can lead not only to physical injuries but also to serious, long-lasting psychological consequences, including depression and anxiety. Symptoms of mental illness: cognitive or memory loss, extreme anxiety or long-term depression, changes in appearance or dress, confusion, disorientation, problems with concentration or decision-making, decrease or increase in appetite, changes in weight, depressed mood or change in mood lasting longer than 2 weeks, feelings of worthlessness, inappropriate guilt, helplessness, thoughts of suicide, memory loss, social withdrawal, fatigue, lack of energy, and sleep changes. The most common mental health conditions for older adults are mood disorders, anxiety disorders, severe cognitive impairment, dementia, and depression. Dementia is a syndrome, usually of a chronic or progressive nature, in which there is deterioration in memory, thinking, behavior, and the ability to perform everyday activities. Depression is the most common mental health condition among older adults. Depression in elderly people often goes untreated because many people think that depression is a normal part of aging and a natural reaction to chronic illness, loss, and social transition. Older adults with untreated depression have highest risk for suicide as compared to other age groups. Depression can cause great suffering and leads to impaired functioning in daily life. Treatment and other support strategies. With the combined efforts of caregivers, family, friends, and mental health professionals, we can help fight off mental illness in older loved ones and make sure they are on the right track to healthy aging. Regular health checkup. Consult your family doctor, counselor, or psychiatrist. Early diagnosis in order to promote early and optimal management. Optimizing physical and mental health, functional ability, and well-being. Training for health professionals in providing care for older people, preventing and managing age-associated chronic diseases, and providing long-term and palliative care. Identifying and treating accompanying physical illnesses. Adequate housing and social support for older people and their caregivers. Proper planning of retirement. Engaging old people in religious and other recreational activities. Health programs to vulnerable groups such as those who live alone and rural populations, programs to prevent elder abuse and providing long-term support to carers, low-cost healthy insurance scheme for the elderly. Seeking effective innovative treatment approaches such as medication, psychotherapy, electroconvulsive therapy, or any combination of the three. Client and family education support groups supporting family caregivers. They need to be careful while caring as they also may be affected with depression. Hence, it is important for family caregivers to take care of themselves. Points to keep in mind: exercise helps relieve chronic pain, helps maintain weight, therefore preventing elderly from developing diseases, improves metabolism, lowers blood pressure and strengthens immune system. Eating a healthy nutritious diet. Eat with a friend or family member to avoid lonely feeling. Diet should include a high fiber diet and lean protein. Drink plenty of water. Water is good for healthy skin and keeps body well hydrated. Stay connected. People who stay along with their family and interact with friends stay healthy in their old age. Spend time with family and new friends because loneliness increases chances of depression and illness. Join a support group. When a change occurs, we need a reliable support system. Talking and listening to people who have been through similar experiences will help you heal. Take care of your look. When you look good, you feel even better. Looking good will make you feel confident. Drink plenty of water. Learn something new every day. To keep your brain alert, indulge in activities like learning a new instrument, language or skill. Laugh a lot. Laugh as much as you can because laughter really is the best medicine for every illness. Once you know the changes that are happening in your body as you age and how to cope with them, then you will be better prepared to deal with them in terms of physical and mental health changes. Mental disorders in old age are frequent and they are frequently underdiagnosed. Most mental disorders are treatable once detected. Untreated mental disorders strongly impair life quality of patients. Mental health is of tremendous importance for functional independence and life quality. Since it is impossible not to have any somatic diseases in old age, it is essential to develop strategies to cope with these impairments, which in turn strongly depend on mental, that is on both emotional and cognitive health. Thank you.